All right, guys, the US healthcare is a $5 trillion industry. It's roughly 20% of America's GDP. And there are 77% of healthcare executives saying AI is the big deal. AI is going to change everything. And that leads us to today's video. What are some business ideas? What are some softwares that we, the average person, can maybe develop to get a piece of that pie? Because if you're just getting a percent of a $5 trillion industry, you're set for life, guys. And if you're watching this video, if you're looking for ways to create wealth online with AI, like I am, most people don't know that this kind of shift has happened. Most people are still doing their day-to-day job, acting like nothing has happened. It's unbelievable to me. I was talking to my barber the other day. He didn't even know what ChatGPT was. And I'm thinking like, bro, I mean, what are you gonna do? The world has completely shifted. And people say, well, the future is coming. No, it's actually here right now. So again, I want to kind of break down some of the data, some of the stats that I'm thinking about when I'm looking for my next project, my next minimum viable product. And I'm looking at the healthcare industry because I think it's interesting. When I speak to entrepreneurs who are building businesses, they see healthcare and education as the number one benefactors of this AI revolution. So, and I mean, it makes sense. They're just huge industries. If there's two things people really care about, it's healthcare and it's their children. It's education and learning and staying relevant. So anyway, without further ado, let's get into some ideas here. By the way, just a quick side note, the expectations that healthcare costs are going to continue to rise, and we want to capitalize on that. And I recorded a video a couple days ago. I'll put a link up there, up above, but I recorded a video a couple days ago that essentially stated, and we're going through unemployment, and essentially you've got about 12 million people on the hunt for new jobs right now, and over the next 5 years, it's predicted that that's probably going to grow to 200 million. 200 million. So that's another huge market, is how do I help people find jobs, get educated, get placed, etc. So that's another, that video is great. I think you'll enjoy that if you're looking for different business ideas. So anyway, just to kind of recap here, when, if you're like me, I'm not a software engineer, I'm not a coder. What I am doing is I'm using tools like Replit to connect APIs, to build software, to build, again, a minimum viable product. What I'm really searching for day one is something that's a one-click solution to a big problem. As I prove out the product, then I'm going to invest more capital. I'm going to bring in better software engineers, people that are more experienced to build out the database, et cetera, et cetera. So at any rate, if you haven't yet, check out these ideas. Check out Replit. Start building, start creating. It's unbelievable what's possible for everyday dudes like you and me. Okay, every day. And one more quick side note before we get into these 5 ideas. Most people out there are trying to teach you what worked for them. And I mean, that makes sense. Teach other people what worked for them. The problem with that is that the world has changed so dramatically just over the last 6 months that learning from someone that built something over the past 1 to 5 years is kind of foolish. And I'm not saying you don't learn anything. I built a few businesses here, none of which have really popped off, but I've been able to quit my day job and live comfortably. But you do learn you learn core concepts. There are core concepts, tried and true throughout business. However, learning from someone how to like build a marketing agency or build these different businesses that have been ubiquitous, like how to grow on YouTube, how to grow on Instagram. I'm not saying that they have no value to give you, but the world's been flipped on its head with AI. So just enter with caution whenever you're going to be paying for coaching, consulting, whenever you're learning from someone, because the world has changed dramatically. So anyway, that's where my head's at. I paid thousands of dollars for training, and when I get through it, I'm like, that stuff seems like it would have been really great 3 years ago, because now the world is so dramatically different. I don't know that it makes sense anymore. And so I'm kind of putting all my chips in this basket of building AI software. Okay. All right. So let's look here. First idea, now that we're into it. First idea, GLP-1 cost optimizer for patients. What is GLP-1? This is basically like the weight loss drugs, these Ozempic type drugs. they're very expensive, and people are going to have a hard time getting health insurance to cover them. What if you could develop an AI app that was able to quickly scour the web, look for coupons, find solutions? I mean, there are millions and millions of people that are using these drugs. I don't see any reason why that would change. You'll probably want to do your own research, go to Grok, and really dive in deep on this. But these GLP-1 drugs are ubiquitous, and if you can help people get a better price, get it for free, get coupons, I think that's a great idea. And it doesn't need to be super complicated. You could use a simple GPT-powered chatbot to scan coupons, discounts, copay card programs, that sort of thing. And by the way, I think that the multimodal usage of ChatGPT is underrated. There's this young man who built a in the same vein of healthcare. He built an app that allows you to scan the food you're about to eat, and it gives you the nutritional information, calories, fat, sugar, all that stuff. And it's a $20 million a year business. So yes, and that's what we're trying to hit, right? We're trying to find that very, very simple, easy solution. And I think that that's a great business idea. I'll tell you another idea that someone came up with in the healthcare industry that is blowing up in just a moment. But let's look at number 2 on an idea that I don't think has been executed on great. A chronic condition care plan generator. Chronic condition care plan generator. So what are the stats behind this? 90% of healthcare costs come from chronic diseases. Diseases that people suffer day in, day out. Okay, and quite frankly, a lot of these diseases may not necessarily need medicine. There might be other ways to deal with it, like chronic back pain, for example. What are some different ways that we could do that? What are some different plans, exercises, things like that? That's just one example. You might want to find your niche within the niche. But the reality is that the way that this business model would work is that the patient fills out a survey. You could run a Facebook ad, fill out these questions. We'll give you your custom plan for $5. You get 1,000 people paying you $5. That's nearly $500,000 business for your first month. That's a pretty big deal. We want more wins like that. By the way, you can see behind me that it's raining, but I'm still committed to walking and committed to sharing these ideas just because it's just endlessly fascinating. Quite frankly, my wife doesn't want to hear about it anymore because all I do is talk about AI. Do you have that problem? You just talk to your wife about AI all day? That's what I do. I can't stop. So anyway, how does it work? The patient fills out a survey. AI generates a personalized care plan that includes sleep, movement, food, maybe even medicine. You're probably going to need to, just look into FDA restrictions and stuff like that. But this could be a direct to consumer, or you could go to health and wellness coaches and say, listen, we got this AI program. It's super easy to use. You implement in your business and you can scale a lot easier. So pretty cool SaaS solution there. I do think we are in this make America healthy again type of environment right now. So finding ways to help people relieve chronic pain, build out plans like that could be extremely, extremely powerful. Because the reality, so one of the things, just to kind of side note here real quick, one of the things that's really powerful in marketing is comparing and contrasting the pain that you have now versus the solution, the heaven that you're going to have in the future. And if someone has chronic pain or chronic illness problem, and you could present an alternative or a way to get out of that pain, that can be huge. So I think that's something that's interesting. Obviously, you want to be careful about false claims and FDA restrictions and stuff like that. But I think that's a really cool idea, and it's something to consider. AI job matching agent for healthcare workers is another idea. Listen, there's predicted to be a $10 million global healthcare worker shortage by 2030. 10 million global healthcare shortage, and you're going to see a lot of people that get laid off and are looking for work. We talked about that earlier in the video. There's about 12 million people on the job hunt right now. Well, what if you had an AI program that helped these people get placed, help them build out maybe it helps them build out their resume, maybe it helps them find work, whether it's through Indeed, or LinkedIn. You can leverage APIs to connect things together. There's some cool things that you could do. You need to kind of engineer this out a little bit. But again, the goal here would be to keep it as simple as possible. And why do I like this? Well, you're helping people find work, which I think is important. And I think we can all agree that's going to be a big problem. A, and B, you're working again in this healthcare niche, which is absolutely massive. It's 20% of the GDP. People are not people need healthcare. Okay, so anyway, you're combining those two. Yeah, so I think that's a great idea. So how maybe a way to work this would be to upload your license plus your skills, and AI finds jobs in seconds from public databases. You could partner with recruiters, perhaps. You could maybe run a freemium model. You could even add on top of that, like based on your information, here's a custom resume and a custom cover letter to help you actually apply for these jobs that you like. So you could kind of build that out just a little bit further. You're going to want to build this idea out a little bit more before you really dive in to decide if this is the project that you want to work on. But I think it's a pretty cool idea. Just any way you can help people get work, I think is going to be big. So this next idea I think is really cool, and I think you're going to really like this. Before I actually mention this next one, I want to share another business that an acquaintance has built up that is phenomenal in the healthcare industry. He is using an AI call bot to call elderly folks in homes who are alone and lonely. And this solves a great problem, because these people that are alone and lonely, they're alone and lonely, and that is a pretty good predictor of dementia. If you're not talking to people, if you're not engaging with people, dementia can set in. We don't want that, and he's grown that business to almost $100,000 in monthly recurring revenue, which is ridiculous. And what he did was he partnered up with the facilities that the elderly people were living in, and did a revenue share with them. So you get, if you enroll here's the problem, here's our solution. If you enroll your members in our program, then we'll give you a kickback. And he's just crushing it, absolutely crushing it. It's just a super cool idea, infinitely scalable. All right, cool. So let's talk about this next idea. I think this idea is really cool. There's a lot of data here that supports it. So let's kind of share this here. So it's a claims denial predictor for small clinics. Okay, not for your larger clinics, but your smaller clinics. And that's, I think, where I would start with an MVP. You solve their problem, it gets bigger. But you might say, Mark, I don't understand, why is this a big deal? Let's talk about the numbers behind this, because this is pretty shocking here. Claims that get rejected, so the average claim denial rate is at 7%. However, for smaller clinics, it ranges higher than that. So let's just say it's 10%. Let's say 10% of claims that the smaller clinics file are denied. That's a big problem, okay? And let's say that small clinic is sending in 1,000 claims per month, okay? So they're sending in 1,000 claims per month to healthcare providers. 10% of them are being denied. By the way, the average cost of a denied claim is $100. That will increase, as we talked about earlier. So that's $10,000 a month in either lost or delayed income for that clinic. Not to mention the cost of time for your team to be following up, and hassle, and so there's an efficiency attached to that too. Which, by the way, anybody that's doing the claims processing within that clinic is going to be like, this is a nightmare. This is the worst. I need AI to help me. So definitely a problem there. So if you put that into a deal annually, you're saying, well, your claim denial problem is costing about $120,000 annually, not to mention the amount of hours that are tacked on to follow-ups and processing. So what if you could build a business idea, an AI product that allowed you to upload the claim information and the encounter notes, and then flag any high-risk fields and suggest corrections before filing the claim. Okay, so essentially what you're doing is you're having the nurse's assistant or whoever is the claims admin in the office is running the reports through an AI program to review and give notes and give tips on how to make changes that will improve the chances of that claim being approved day one. That's a big deal. And let's say it worked, let's just say it's 20% effective, okay? 20% effective. That's, you know, in this example, that's about $30,000 in revenue captured, 30,000. And again, not to mention the reduced costs in managing the claim and the people that are dealing with these problems. So I think that's a super cool idea. It seems very reasonable to me. And, you know, let me just kind of recap here. And I mentioned this the other day. Alex Becker, who built out an insanely large, you know, $100 million plus software for marketing agencies, had this post I just thought was really phenomenal. I talked about this in another video, in that we you know, if you really want to grow a large SaaS business, getting hyper focused on your client, your customer, their problems, and finding solutions is the key. And I'm not saying that, you know, this idea is going to be an easy one, or any of the ideas. Some of the ideas that we talked about today are a little bit more complicated, but the bigger the problems, the bigger the payoff once you're able to solve them. So I would encourage you to go check this out. Think about the healthcare industry. Think about unique problems. I'm still a huge fan of AI voice. I think it's completely underrated. AI voice is huge. AI video, I think, is huge too. I'm starting to play with it, but AI voice is insanely good. Insanely good. So I would leverage, you know, anything leveraging AI voice is good. Anything in the healthcare industry is going to be good. And, you know, where I'm at right now is simple one button fixes, which is one of the reasons I kind of like this idea about claims. And now that's, out of these 5 ideas, that's my favorite, because you could simply take pictures, it reviews it, bada boom, bada bang. So thanks for watching the video today. Thanks for subscribing. Now go out and make your business happen, because the reality is nobody is gonna come to save you. We're gonna go through a time of extreme economic peril over the coming decade. But if you can start winning now, not just start learning the skills, not just building a business, but actually diving in, you're gonna become an incredibly valuable member to society. And I think your wife is gonna like that. All right, I'll see you in the next video.